Hi, my name is Kathleen. Can I come in?
Go.
Yes, come in.
Hi, my name is Kathleen. I'll be your CNA for today. I'm here to do perineal care on you. Is that okay?
Yeah, that's okay.
Okay. I'm just going to check your wristband. Is that okay?
Yeah, that's okay.
And can you give me your full name and your date of birth?
Myra Hernandez Luna, September 7th, 2000.
Thank you. I'm going to lower your bed and give you some privacy while I collect my things. Is that okay?
Yeah, that's okay.
Hi, Myra. It's Kathleen with your supplies. Is it okay that I come in?
Go.
So before we put down our supplies, we want to make sure we place a barrier on the table and then place the supplies on top. And now we're going to grab a basin from the patient's cabinet. First, I'm going to fill the water basin with warm water, and I'm going to check with the patient to make sure the temperature is okay. Then you want to make sure that the patient is comfortable with the water temperature. Can you check this to make sure that it's okay?
It's okay.
Go.
And then before starting, you're going to want to make sure that you put on your gloves. And now you're going to want to grab a privacy blanket and put it over the patient. And then you're going to want to make sure you pull the blankets from underneath the privacy blanket. Now you're going to want to get the patient into a side-laying position. You're going to want to remove the dirty chuck, and you're going to want to make sure you raise the other end of the bed to make sure that the patient is safe while you're doing so. Now you're going to grab a new chuck, and you're going to want to replace this with the old chuck. And then you're going to roll the dirty chuck in and replace it with the clean one. Now we want to lift the privacy blanket up over the perineal area. And you're going to want to place a towel over the patient's legs. We're going to be using the four-corner method, so you're going to dip your towel into the water, drain it out, and then on each of the corners, you're going to want to spray. Now we're going to be using our opposite hand to open up the vagina, and use the first fold to go front to back. And then you fold it over to the side, fold it over to the other side. Then you get in between the thighs. And after we soap, we rinse. And after we soap, we're going to want to use the same sequence with rinsing. So you do the first fold, front to back, to the side, side. And you get in between the thighs. Now you're going to want to discard the old towel, and you're going to want to pat dry. Now we're going to get the patient into a side-laying position so that we're able to wash her backside. Now we're going to clean the backside. You go from the anus away from the vagina. So you're going to do one fold on one side of the anus, the other fold on the next. Then you go through the middle. And you want to make sure you go until it's clean. Then you're going to discard the towel, and after we soap, we rinse. Now we're going to want to rinse in the same sequence that we soaped. and then we pat dry. And now we replace the chuck. Now we're going to remove the bath blanket, give her old blankets back, retract the privacy curtain. You want to make sure a call light is within reach and see if your patient needs anything before you leave and clean up your materials.